Welcome dear student in a one another session. Myself Darshana Sandeep Shinde and our today's discussion topic is sterilization. In that we see the physical method. Learning outcomes. After watching this video, students should be able to understand and recognize the concept of the sterilization. What is meant by physical sterilization, dry heat sterilizations, then moist heat sterilization and radiation sterilization. Important definitions regarding these sessions are: what is meant by sterilization? Sterilization is the process by which an article, surface or medium is made free of all the microorganisms, either in a vegetative or in a spore form. Disinfection is the process of destruction of all the pathogens or the microorganisms capable of producing the infection in the living cells but not necessarily the spores. All the organisms may not be killed, but number is reduced to a level that is no longer harmful to the health. Disinfectants, these are the antimicrobial agent that is applied to the surface of non-living objects to destroy the microorganisms that are living on the objects. Antiseptics are the chemicals which can be safely be applied to the living tissue and are used to prevent the infection by inhibiting the growth of the microorganism. Asepsis technique by which the occurrence of the infection into the uninfected tissue is prevented. Bactericidal agents or germicides, these are the chemical substances which are able to kill the bacteria or the germs. Thermal dead time, it is the minimum time required to kill a suspension of organism at the predetermined temperature in a specific environment. The thermal dead time is inversely proportional to the temperature. Thermal dead time increases in the presence of organic substances, protein, nucleic acid, starch, gelatin, sugar and fats. We see the classification of the sterilization. Classification is divided into three parts. First is physical method, then chemical method and mechanical method. Physical method is divided into three parts. Dry heat sterilization, example of its hot air oven. Then moist heat sterilization, example of its autoclave. Then radiation sterilization is divided into two parts, that is use of UV rays and ionization radiation. Chemical method is divided into two parts. First is sterilization by heating with the bactericides and second is the gaseous sterilization. Mechanical method involved the filtration, in that ceramic filter, seeds filter, sintered glass filter, sintered metal filter and membrane filter. Physical method in that first is dry heat sterilization. It is a heat is mostly reliable and rapid method of sterilization. It involves the mechanism protein denaturation, oxidative damage, effect on the elevated levels of electrolytes. Then time required for sterilization is inversely proportional to the temperature of exposure. This can be expressed as thermal dead time, which is the minimum time required to kill the suspension of microorganism at a temperature and a specific condition. This is the hot air oven used for dry heat sterilization. It has a temperature and time ratio. 170 degrees Celsius, it requires 60 minutes. As the time decreases, time will be the increases. Normally, the spores as well as a vegetative form of the all microorganisms are killed in 2 hours at a temperature of the 160 degree Celsius. Then advantages, it is suitable method for the sterilization of substance destroyed by the moisture. They are not required water and there is not much pressure build up within the oven, unlike the autoclave. Make them safer to work within. Suitable and necessary to be used in a laboratory environment. They are much smaller than the autoclaves but can still be effective. Disadvantages include long heating time, high temperature. Dry heat sterilizer, they are use dry heat instead of the moist heat, and some organisms are superior and may not be killed by them. Then the second part is of physical method is moist heat sterilization. It involves the three processes: killing of microorganisms above 100 degrees Celsius, that is the autoclave, then pasteurization below 100 degrees Celsius and tyndallization. First of all, we see pasteurization below 100 degrees Celsius heating. It is used for the milk, ice cream, yogurts and fruit juices. Heat tolerant microbes survive. Batch method, it is a temperature below 100 degrees Celsius which is suitable for the pasteurization of the milk. developed by the Louis Pasteur to prevent the spoilage of the beverages, used to reduce the microbes responsible for the spoilage of the milk, wine, juice, etc. It was exposed to 65 degrees Celsius for 30 minutes. Then inspissation is the process when heating high temperature protein containing media, for example, enable to recovery of the bacteria. Then nowadays pasteurization include the milk is exposed only to the 72 degrees Celsius, that is high temperature short time pasteurization. And then microbacterium, brucella, salmonella, relatively heat resistance may be survive with the this folder method. Then heating with the temperature at 100 degrees Celsius, it involves the three processes: boiling, tyndallization, and steam sterilization. Boiling for 10 to 30 minutes may kill most of the vegetative forms of the spores with stand boiling. Tyndallization, steam at 100 degrees Celsius for 20 minutes on the 3 successive days. It is used for the egg, serum, and sugar containing media. Then steam sterilizer, steam at 100 degrees Celsius for 90 minutes, used for a media which are decomposed at a high temperature. Then under the category of moisture sterilization, autoclave. Autoclave is a steam above 100 degrees Celsius, has a better killing power than the dry heat. Bacteria are more susceptible to moisture. Target both vegetative and spores. Components of autoclave. It consists of vertical, horizontal, cylindrical, and gunmetal or stainless steel. Lid is fastened by the screw, airtight by the asbestos washer. Lid bears a discharge tap for air and steam. Pressure gauge, safety valves. We see the detailed construction of the autoclave. It consists of strong metallic chamber made up of stainless steel. It has a cover fitted with the steam vent, pressure gauge, safety valve. Rubber gasket is fitted on the inner side of the lid in order to make the autoclave airtight. The cover is closed with the nuts and bolts. The electrically heated element is fitted at the bottom to heat the water to cover into the steam. The perforated inner chamber is placed on the stand. The metal to be sterilized is loosely packed into it. This is the diagram of the autoclave, which has a pressure gauge. This is a pressure gauge, pressure regulating device, safety valve, autoclave lid, outer stand. These are the pressure releasing valve, vacuum release, etc. Working. A sufficient quantity of water is poured into the chamber after removing the perforated chamber. The elevator or the level of the water adjusts in such a way that it does not touch to the bottom of the perforated chamber. The material is packed in the perforated chamber and lid is then closed with the wings, nuts and the bolts. This is the table which shows the required temperature and time for the autoclave. 120 degree Celsius it required 15 minutes, 126 degrees Celsius 10 minutes, and 134 degrees Celsius it required only 3 minutes. Use of autoclave. Useful for the materials which cannot be withstand with the high temperature. To sterilize the culture media, heat stable, liquid, saline solution, heat resistance equipments, and syringes. Rubber material, gown, surgical dressing, instrument, glassware, ampoules, and gloves. Unsuitable for the anhydrous materials such as the powders, oil, fats, ointments. Disadvantages of autoclave. Some plastic wear melts in the high heat and sharp instrument often become dull. Moreover, many chemicals break down during the sterilization process and oily substance cannot be treated because they do not mix with the water. Then, third part of physical method is radiation sterilization. This involves a two type or it has a two type: sterilization by ultraviolet light and sterilization by ionization, radiation ionization. First of all, we see the sterilization by the ultraviolet light. Direct sunlight can destroy the microorganisms. Oil account of its ultraviolet rays of the long wavelength. The sun emits both ultraviolet rays of long as well as short wavelength. Ultraviolet rays of a short wavelength are absorbed by the Earth's atmosphere, and the antimicrobial activity of UV light depends upon its wavelength. Its maximum at the 265 nanometer wavelength. Application of UV rays. It is used for the sterilization of ear to prevent the cross infection in the hospitals. It is used for sterilization and maintenance of the aseptic area in the pharmaceutical industry. It is used for the sterilization of thermolabile substances before packing, destruction of the virus, homologous serums, jaundice in the plasma, inactivation of the viruses in the bacteria in the vaccine production. It is also used for the sterilization of the surface of working tablets, rooms where the aseptic technique is to be performed. The UV lamp should be installed in the ceiling and it should be shielded in order to protect the worker from the harmful effects of the UV radiation. Disadvantages includes ultraviolet rays have a low penetration power, so it is not applicable to the sterilization of packaged or packed pharmaceuticals. UV rays are less effective against the organism in the atmosphere or surface in the relative humidity high. Then radiation is partially screened by the dust or the grease on the lamp, so regular cleaning of the lamp is necessary. UV light is harmful for the workers. The eye, skin should be protected from the direct UV rays. Then sterilization by ionization radiation. Ionization radiation are X-rays, gamma ray. These are lethal to bacteria and destroy the nuclei of the cells. Gamma rays are produced from the radioisotopic source such as the cobalt-60, then cesium-130, then electron energized by the suitable electron accelerator. Its dose is 2.5 mRes. Advantages of its ionization radiation. Gamma rays have a high penetration power, so material sterilized after filling in a final container. No aseptic precaution is required. The thermal rise is negligible. The method is suitable for all types of materials such as the dry, moist and frozen one. The method is reliable and can be acceptable, controlled. Disadvantages of ionization radiations are the plant is very costly. A lot of capital is required for settling of the plant. Then the process cannot be stopped once it is started because the radiation cannot be switched off. The radiation are harmful to the workers. It produces undesirable changes in many medicaments such as the color, solubility, texture and product. Application of ionization radiation. This method is mainly used for sterilization of plastic syringe, hypodermic needles, cups, then surgical blades and adhesive dressing. It is also used for sterilization of the bone, transplant tissues, then plastic tubing, catheters, sutures. It is used for the sterilization of thermolabile medicament. In this session, we cover the importance of sterilization and in that dry heat sterilization, moist heat sterilization, radiation sterilization. In this session, we learn about the physical sterilization. Thank you. Thank you very much for watching this video.